Hello, this is Dr. Wells with Wells Medicine, and a lot of people ask me if stellate ganglion blocks hurt. So the short answer is yes, but the longer answer is um, if you've ever had an IV or a flu shot before, they feel about like that. So the needle that we use is very, very tiny. It's actually about the same size as the gauge of needle that we use for flu shots. So it's a very, very tiny needle. And once we put the skin numbing medicine in place with that very, very tiny needle, the very small needle, which is only slightly larger than the very, very tiniest needle, goes through that numb area, and patients really don't feel that much at all. They feel a sensation sort of movement or of pressure from the ultrasound probe as I'm looking around for the right place, but they don't feel a sharp or cutting or pinchiness to the needle placing the medication for the stellate ganglion block. Now, because we're using about 5 cc's of, or 5 milliliters of fluid at each location. 5 milliliters of fluid is slightly less than the size of a golf ball. So we're using that fluid. It's kind of spreading the tissues apart a little bit. So it can feel like there's a bit of pressure or a bit of soreness in the neck for a day or two afterwards as that sort of bruised feeling heals. But there really shouldn't be any sharp discomfort, sharp pain associated with it at all. It really is pretty comfortable. Most patients very comfortable moving their neck, even right afterwards. And we usually don't leave any bruising, any signs other than two little, looks like mosquito bites or vampire bites. Uh, that heal up really quickly within 2 or 3 days. So for the stellate ganglion block, really no big discomfort at the time of a procedure. It feels a little bit like getting a flu shot. I know a lot of people are squeamish about it because it is in the neck, but we talk through it the whole time. So there's a lot of distraction, a lot of the numbing medicine, so that patients don't really feel it much at all.